Here we go, another day of some fantastic knowledge you're about to hear from Dr. Mike. What do we got today?
First off, I just want to say thank you for everybody for watching our last video. We had 12 shares and nearly 1,700 views in our last video.
That's sweet.
So thank you guys so much. Please keep sharing our videos and comment below. You can interact with Coach John and I. Today, we are talking about performance biofeedback. What is biofeedback? Biofeedback is all about balancing the nervous system, okay? Making those things that are typically unconscious to us, those bodily functions that are unconscious, helping us be conscious of those and gain control over them so that we can self-regulate, okay? And so things like we can gain control over our heart rate, over our muscle tension, our pain perception, our blood pressure, that list goes on. And what does that look like? That looks like patient comes in or athlete comes in, they get hooked up to these sensors, a respiration belt, a heart rate sensor, peripheral temperature, peripheral sweat response, and then a surface muscle tension sensor, all of which are a measure or a gauge of that autonomic nervous system, which we'll come back to and talk about in a moment. But they get hooked up, and then through a monitor here on the screen, they can see in real time that live feedback of how their body is responding. So they can actually see their physiology on the screen. So really, really cool. Now, how we use this in performance, in athletics, first and foremost, balancing that nervous system, okay? We're gonna come back to that and talk about it in a moment. The other is increasing focus and concentration. This is particularly useful in athletes that have performance anxiety. Another thing that we do is performance visualization before competition. As crazy as it sounds, the research actually shows there is a correct way to do performance visualization.
Yes.
Certain nervous system measurements should go up and some should decrease. So that's something that we train in performance biofeedback too. Another thing that we do is limiting that excessive low-level muscle tension that athletes hold in muscles that they don't need to use during competition. For example, if a baseball player, coach tells me that he's always activating this shoulder and it's always up, and it doesn't need to be up for him to swing that bat. We'd put that sensor on there and we'd show him what's happening, and then we'd use different mind-body techniques like progressive muscle relaxation or autogenics to help him relax this down, and now he has a better skill, a better technique. So we fine-tune that skill and technique utilizing the surface muscle tension sensor. And then another thing that we do is track those nervous system measurements to actually assess an athlete's training load. So how much stress can they handle today? How much of a training load can they handle today? And then did they recover from last time? So their recovery status. Did they recover from their last training session? So all numbers that I look at when I'm doing performance biofeedback with an athlete. Now, coming back to the nervous system. We're looking at the autonomic nervous system. There's two parts to the autonomic nervous system. There's the sympathetic, that's your fight or flight, right? If we heard a loud bang, or if the classic example is if a bear walked through the door right now, Coach John and I, we would get activated, right? And we would mobilize. We would fight or we would flee. So those...
See ya.
He'd be up on this desk.
Much.
So those hormones that get secreted are adrenaline, epinephrine, norepinephrine, cortisol, right? And those, when we're in that nervous system, that fear response happens. And that fear response is part of the amygdala. That's that limbic structure of the brain. And when we get stuck in those limbic structures of the brain, we're not going to be able to focus or concentrate. Our memory becomes impaired. And so all those executive functions that happen in the prefrontal cortex, if we get stuck in that amygdala, it's going to impair those abilities to focus, concentrate, memory, all those things. So that's the sympathetic nervous system. Now contrast that to the parasympathetic nervous system. The parasympathetic nervous system is that rest and relax nervous system, or rest and regenerate nervous system. And the hormones that get secreted when we are in that relaxed state for recovery are testosterone, IGF, And those are going to help us recover, and dopamine, which is going to help us focus and concentrate. So we train to balance that nervous system, the autonomic nervous system. The research has shown that the simplest and most effective way to train that autonomic nervous system is using the breath. So actually using breathing, and not just simply breathing, but breathing using the diaphragm. The diaphragm is that large respiratory muscle that sits on top of the abdominal organs right underneath the ribs here. And when we activate that diaphragm, we activate the parasympathetic nervous system via the vagus nerve. The vagus nerve is cranial nerve number 10. Starts up at the brainstem, goes down through the neck, through the chest, attaches to the heart, and then it goes down to the abdomen and attaches to the diaphragm. So when we breathe into the belly, we use that diaphragm muscle, we engage the parasympathetic nervous system via the vagus nerve. And it's like exercising. When we do this belly breathing, it's like exercising that vagus nerve, and we exercise that parasympathetic nervous system, and we make it stronger. So we actually build resiliency in our nervous system. So that's one way we build resiliency in the nervous system.
You know, it reminds me how most people don't even know how to breathe correctly.
Yeah.
Like, for instance, since you're sitting in a chair listening to us, we want you to do this. Take a deep breath in, and notice when you breathe in that most people move their chest. The chest goes up and down. Shoulders go up and down. Mm-hmm. And that is wrong. Your abs should move. Like, for instance, look at a baby. A baby will lie in a crib. When they're sleeping, you'll see their abs move. Their shoulders don't move up and down.
Yeah. Yeah, so you're talking about dysfunctional breathing. That's dysfunctional breathing when we're using these chest muscles, mm-hmm. these accessory muscles of respiration. Those muscles are directly connected to the sympathetic nervous system. So these are fight or flight. So if we use these muscles of respiration here, we're going to be in that sympathetic fight or flight nervous system. If we're using here in the belly, we're engaging that parasympathetic nervous system, that rest and digest, rest and relax nervous system. We'll come back to hyperventilation and talk about that in a moment too. Another way that we build resiliency in the nervous system is through what's called the baroreceptors. The baroreceptors are these pressure sensors or stretch sensors, and they're in the carotid sinus, the aorta, the chambers of the heart. And when we activate those baroreceptors, and when we activate them is when we breathe at a very slow pace, so a pace 4.5, 6.5 breaths a minute. That's the pace I'm talking about. Conventional physiology textbook will tell you that a normal breath rate is 12 to 20 breaths a minute. For the purposes of biofeedback, that's overbreathing, okay? That's chronically hyperventilating. So when we breathe at that slow pace, diaphragmatically, we engage those baroreceptors, and that does two things. It decreases our baseline respiration, so it decreases our respiratory drive. So if I'm breathing at 16 breaths a minute normally, and now I do some biofeedback training, some breath training for a few weeks, my baseline respirations, if I'm engaging those baroreceptors, should drop down. Mm-hmm. So now I'm at a parasympathetic level, let's say 8 breaths a minute. So that's one way. The second thing that's going to happen is that the baroreceptors, when they're activated, are going to decrease or actually inhibit the sympathetic nervous system. So it inhibits sympathetic nervous system, which means it increases parasympathetic nervous system. So another way that we build resiliency in that autonomic nervous system is through the baroreceptors. Now, coming back to talking about chronic hyperventilation for a moment. Chronic hyperventilation looks much differently than acute hyperventilation, which is what's seen in panic attacks. That's that very rapid, very rapid breathing, right? Chronic hyperventilation looks a number of different ways. It can look like taking in a deep breath and holding it. It can look like sighing frequently, yawning frequently, right? We all do that. And most of us in our society do tend to be chronic hyperventilators. When we are chronically hyperventilating, again, we get stuck in that sympathetic nervous system. And when that happens, after just 3 minutes of chronically hyperventilating, we decrease oxygen to the brain and to the heart by 30%. So, of course, we're going to have issues with focus and concentration and memory if we're chronically hyperventilating. After just 3 minutes, we decrease oxygen by 30% to the brain.
Is that one of the reasons why when a person, don't really happens to me, so I don't know about this very much, but when a person gets pulled over by a police officer and they see the lights Like,
Yeah.
of course, I don't know anything about that. Nothing at all.
Yeah, it's a very good example. Yeah, absolutely. So another way that, or another term for performance biofeedback is heart rate variability biofeedback. That's the variability in the beat-to-beat variation of each heartbeat. So we're going to do a quick exercise. Everybody can do this that's watching. Coach John, I'm going to ask you to do something. So I want you to, first of all, find your pulse either in your neck, your carotid here, or on the or on the thumb side, which is the radial pulse. So once you find your pulse, you got it.
I'm dead.
One in your neck is easier. If you
Yeah.
want. Right there.
Oh yeah, I got it.
You got it? Okay. What I want everybody to do, take a deep breath in and hold it. Notice what happens to your heart rate. Okay, now breathe. Now, we're going to do the same thing. Take a deep breath in. This time, very slow exhale. And notice what happens to your heart rate. Okay, what did you notice?
Slow down.
Slow down on the exhale.
Yes.
Yes? So, that's also heart rate. It's called a respiratory sinus arrhythmia. It's a natural, normal, benign arrhythmia. It's been there since birth. It's also called heart rate variability. We want that variability to be very high. We want the maximum amount of variability because that's the best biomarker of cardiovascular health. That's also what we use to gauge somebody's autonomic nervous system and their physiological stress. It's actually the best measure of someone's physiological stress level.
That brings me back to the times when I used to do martial arts, especially a style called Tai Chi, where you're very slow.
Yeah.
And conscious, but they never explained it like that.
No.
I wish they did.
A little too more technical than that. So our nervous system knows that our body is fatigued well before we are ever conscious of it. So that's what we can see when we look at these heart rate variability measurements, and that's why we track it. Another reason why we track heart rate variability is because we can actually prevent injury from occurring. So we can see if someone's nervous system is running more sympathetic with their training, and over time, if they just keep going down and down and down, they're going towards a more injury state. So we can track that and we can measure it. And the research is also clear that if an athlete has increased heart rate variability, that they perform better. So it's so cool, and that's why it's something that we track. Now, athletes and coaches always train, and these are important, always train technique and skill, which is very important, strength and conditioning. What's the one thing that they always forget about? Recovery.
Yep.
Nobody trains recovery, and recovery is just as important, I would say even more important than those three. Well, maybe not skill. Technique and skill, probably number one, but recovery is right up there. And the way that I think about recovery is, if this is your nervous system, okay, this is the balance of your nervous system, this is your baseline. When you encounter a stressor, okay, the stressor is going to be exercise, so either strength and conditioning, something like that. When you exercise that stress, now your baseline is going to go down, okay? But when we recover, and if we recover properly, and that's the thing, if we recover properly, we should compensate and we should move up. So now our baseline is up here, okay? So that's proper training. But if we don't recover properly, and again, we go down here after that stress, now I don't recover properly, now my baseline moves down. And I go closer and closer to an injury state.
Massive injury.
Yeah. So that's something else that we look at and we measure, and people, especially coaches and athletes, just do not think about recovery enough. And nobody thinks about training their nervous system to recover. And the research shows that that's the best way to actually recover from stressor, from exercise, is actually training your nervous system. So very few people train recovery, almost nobody trains their nervous system, and we can actually build that physiological resiliency and adaptability into our nervous system so that we can handle more stress, meaning that we can handle a more intense training load. Make sense?
Oh, yes.
Okay. Another thing that I do with athletes is track what's called morning readiness. This is a 3-minute snapshot of how their nervous system is functioning, basically, and how much stress or how much of a training load they can handle today. And it shows us how much, did they recover from the session? How much did they recover from their last training session? So that's what a morning readiness reading is all about. So what that looks like is I'll have athlete get a not a respiration belt, a chest strap, a heart rate sensor, a polar heart rate strap that they'll use every morning. Usually I recommend the H7 or H10. There are some other wearable devices. There's an Oura ring, there's different wristbands, wrist devices, watches. The research has shown that these wearables just aren't as sensitive as the polar heart rate strap is. Because the polar heart rate strap is an ECG, it's a 2-lead ECG, and those other wearables are what's called a PPG, a photoplethysmograph, and they're just not as sensitive to pick up the type of data that we need for an accurate heart rate variability measurement. So that's one of the things that we also track every single morning. Now, a couple of things that we use to train recovery. Remember, that's the fourth thing that everybody forgets about. So to help athletes and coaches train recovery, I talk to them about, first, slow pace diaphragmatic breathing. We retrain their breath. We talk about nutrition. Nutrition has a large impact on their nervous system. Float tanks, those sensory deprivation tanks, are actually a great way if someone is more sympathetic, that we can bring them down to a more parasympathetic nervous system and balance them out. So I use float tanks a lot for the athletes. Meditation, visualization, and then also supplementation and herbal medicine as well. Something that doesn't get talked about enough is actually sleep hygiene. So the research actually shows that, one, if we don't get enough quality sleep, that our heart rate variability is going to decrease. And also, if we sleep next to somebody, and this is fun, this is crazy, if we sleep next to somebody, we actually don't get as much restful sleep as indicated by our heart rate variability as we would if we're sleeping alone.
Especially if they kick you?
Yeah. Joe's laughing behind the camera right
Especially
now.
Especially as a karate dream. What? What are you doing? Yeah.
So I tell my athletes that they should be sleeping alone.
Remember that. Sleep alone.
So heart rate variability biofeedback, performance biofeedback, it isn't just about increasing performance. I'm a naturopathic physician. I'm all about individualized medicine. And HRV Biofeedback is about optimal performance for that athlete specifically, training their nervous system specifically. So that's why this is so cool. And so far, this is something that not many people are using. There's, some professional sports teams are using it. Our Chicago Bears, they use it. Some Olympic teams are using it. Very, very, very few college teams are actually using this right now. And as far as I know, there are no high school teams, no amateur sports teams, especially in the state of Illinois, that are utilizing this technology so far.
And this is the reason why we wanted to combine what we do, because no one does it.
Yeah.
And we need to.
Yeah, and that is a great point. This is the athletic training of the future. Everybody's going to be tracking this, just like functional movement training. Once coaches and athletes catch on and they understand the value of measuring their heart rate variability, they are going to want to train their athletes this way. And the way that I think about it and I explain it to people is, so my sport was wrestling. I was a wrestler, and I was multiple time state placer, on scholarship to a Division I school. And in wrestling, it's all about, if you work harder than the other guy, you're going to do better, right? It's train, train, train. Train as hard as you can and you'll do better, right? But what the research shows is that it's not about who trains harder, it's about who trains smarter. So, for example, in my college career, almost every single year in my college career, I had an injury, and I had to fight through it. And I thought that I just had to keep going and going and going. I was banging my head against the wall. I didn't know about this. This wasn't a thing back then. But now we have this, and we can train an athlete much smarter nowadays, which is very, very cool. And that's why I'm so excited to bring this to Illinois and bring this to you guys, to this audience. So I'm very, very excited about this.
It makes me excited too because of the fact that you said train smarter, not harder.
Yeah.
Because like I remember back in the days when I was doing martial arts at some other schools, not the ones here in Illinois, they used to preach, pain is weakness leaving the body.
Mm-hmm. Yeah.
Well, back then I was a little bit of a smarty-arty. So I would say, really? So if I break your leg, what weakness is leaving your body?
Mm-hmm. Yeah. Doesn't make sense.
Nope, not at all. So that's the reason why we're doing this. We want to increase awareness. We want to decrease the amount of injuries.
Mm-hmm. Yep.
If you can't control your body slowly, you can't control it fast. That's against physics.
Yeah. So I've got an upcoming presentation at Plainfield Chiropractic on July 27th. It's at 11 a.m. on Saturday. And it is a live demonstration of all the biofeedback sensors. So I'm going to select somebody from the audience, hook them up to all the sensors, and then show everybody the information that we can see from all those sensors and then how we use that in biofeedback training. So it's a really cool presentation. If you can, please come out. It's on my Facebook page, ACEO Natural Medicine, ACESO. And next week we've got another Facebook Live, and it'll be about injury prevention and rehab. So we'll be talking more about functional movement training when it comes to injury and rehabbing that injury. Alrighty?
That's fantastic. I look forward to it.
Yeah, same here.
Thanks a lot, Doc.
Alrighty.
Okay. Look forward to seeing you guys again. Have a good one.
We'll see you next week.